I'm delighted to be here to speak today, particularly as I recognise some names we've emailed about vitamin D over the last few years. As I was explaining to Rufus, and some of you already know, NHS reorganisation makes things complicated. So what I'm talking about today is Heart of Birmingham teaching PCT's vitamin D policy and campaign. They're not my employer, I work with them. And again, because of reorganisation, by the end of the presentation, I can tell you how things have moved on beyond the HOB TPCT policy and campaign. So the background to this was that in early 2004, the paediatricians from the Children's Hospital approached the Director of Public Health because 65 cases of vitamin D deficiency in under 5s had presented at Birmingham hospitals. So that's vitamin D deficiency of a level requiring treatment. The Heart of Birmingham population was 75% non-white at the 2001 census. So we anticipate that that proportion will have increased by the time the next figures are available. So obviously, the majority of the population are at high risk for vitamin D deficiency. However, as other people have drawn our attention to earlier in the day, everyone in the UK is at risk of deficiency, and Birmingham and further north, we don't get the right kind of UVB between October and March. So we're all at risk. We set up our case with the background of national recommendations. COMA recommends supplementation for children aged up to 5, and relatively recent NICE guidance recommends supplementation of vitamin D during pregnancy. The recommendations are slightly different in the two lots of guidance, but at least they raise it. So we got our policy approved by the Professional Executive Committee and the board of the PCT in 2006. And that was to make free vitamin D supplements available to all women from the start of pregnancy until their child was 1, and all children under 5 years old if they were registered with a GP affiliated to this PCT. Our aims were to eliminate D deficiency in the target population. Now, in light of what we've heard this morning, this seems both ambitious and naive, but it certainly was what the group were thinking about when they were set up. And I think, again, I've talked to a few people about the difficulties of implementing something that sounds so simple, giving people free vitamins. So what I'm going to talk about is that process. So leaving to one side that probably the national recommendations aren't adequate to achieve the effects that much higher doses of vitamin D could do. So we wanted to ensure awareness of the scheme among the families in the target population, knowledge in NHS, that we wanted to make sure knowledge was high and promotion was consistent, and that access to supplements is easy and consistent for all the women and mothers, pregnant women and mothers of young children, and that understanding by the public is sufficient to maintain uptake of supplements. Obviously, it's great if people take their one bottle, but it'd be even better if they carry on, come back for more. So in the early stages, when we launched our scheme, the National Healthy Start scheme wasn't up and running. So health visitors were issuing Abidec for children, and GPs were asked to prescribe calcium and ergocalciferol to women. Some of you may have experience of these. We sat round the table at one of our steering group meetings and chewed our way through the calcium and ergocalciferol and agreed that you wouldn't take it if you were nauseous or had heartburn or anything. So, but that was the best we could do at the time within the budget and with what was available. There was a gradual increase in the giving out of vitamins, and the Healthy Start children's vitamins became available in the November of that year, followed by the women's tablets in April 2007. So that was a big advance because it was the right preparation for us to be able to easily signpost people to and give out. I'm just going to very quickly do a bit on the National Healthy Start scheme, and apologies to those of you who know this very well. But it was launched in 2006 to replace the welfare food scheme, which was the old scheme was really known to people as your milk tokens. Women should be enrolled by a midwife as soon as pregnancy is confirmed, and it's aimed at families on low incomes, and they get food vouchers. So it's 1 voucher a week during pregnancy, 1 voucher a week for children aged 1 to 4, and 2 per week for babies aged under 1. The The vouchers can be used for milk, formula milk, fresh fruit and vegetables, and from last month for plain frozen fruit and vegetables. And the aim is to encourage early contact with a health professional in pregnancy and to promote healthy eating during pregnancy and in weaning. Now, the vitamins felt at the beginning a bit like an add-on. Every 8 weeks now, the beneficiaries receive a vitamin voucher. Because initially I think it was mentioned to people, but there wasn't a clear voucher that they were sent. So that's the composition of the vitamins. The women's and children's are different because of the vitamin A. But as you can see, it is low doses of vitamin D compared to what we've been talking about this morning. Any retailer stocking milk, formula or fruit and vegetables can register under the Healthy Start scheme, but PCTs are responsible for getting the vitamins to families. And there's no one-stop shop for beneficiaries, which we've always seen as a big weakness of the scheme. You can't go and get your fruit and veg and your vitamins from the same place. GPs can't prescribe the vitamins, and some of our GPs who are very aware of the problem of vitamin D deficiency would like to be able to do so. And pharmacists can't order them. They're available through NHS supplies, not through the pharmacy ordering scheme. So for our scheme, it was important that women were advised to collect the vitamins by their GP, midwife or practice nurse once pregnancy was confirmed. And we gave them a postcard with our vitamin D logo to record issues, because at that stage, they hadn't necessarily got their antenatal notes confirming that they were pregnant. Health visitors give out the children's drops at the primary visit, which is usually when the baby is around 2 weeks old. And parents are given information on where to request further supplies. We feel we've got access quite good by moving it from beyond health centres into GP practices, where GPs were keen. All of our 29 children's centres give out the vitamins, and they tend to give them out all the hours that they're open. And we've also got 29 pharmacies on board, and they're pharmacies that are part of another health initiative in Birmingham offering free pregnancy testing to encourage early booking with a midwife. You won't be able to see the detail of that map, but every spot is where you can get vitamins. And there's a couple of bald patches, but I can assure you one of those is a big park, the one near the top left-hand side. And the one sort of in the middle is a sort of industrial hinterland with gas towers and things. There's not many families of under fives living there. So our coverage is quite good. However, health centres tend to only issue vitamins when baby clinics are running. So if your nearest nearest health centre has a baby clinic on Tuesdays, 1:30 to 3:30, that may be the only time you can get them. Children's centres, as I've said, are a bit more flexible, and the pharmacies, obviously, because many of them open late, can provide out-of-hours access, and may be particularly important for working mothers or first-time mothers who aren't going to health centres or children's centres. And as I said, GPs were keen to be involved in some cases, so they issue via their reception area. Awareness. We've had several studies carried out by students over the life of the campaign. They're not good enough to publish, but they do show a gradual increase in public awareness of what vitamin D is, the fact that you don't get it from food, and the disease is caused by a deficiency. Our logo and promotional materials were developed with public involvement, so whether we liked them or not, they were considered acceptable to local people. We've had reasonable media coverage, and we've done bus adverts, as well as a campaign by shopkeepers in particular ethnic minority shopping areas. So where there are small independent retailers, they gave out leaflets for a couple of months for us. Professional awareness is now very high, particularly among health visitors. So that's a picture of our leaflet, and we have got them in community languages. The idea is that the leaflet is given with the vitamins. It's not meant to be a standalone health education tool, because a lot of us are probably aware that that's not particularly useful. Problems and barriers we've faced. Reception staff can act as gatekeepers, and they try to ration the vitamins to people. And I've had receptionists phone me up and say proudly, this man came back because he said he'd smashed the children's vitamin drops, and could he have some more? And I told him, no, go away and wait 8 weeks. And they're really pleased with themselves. And I'm saying, why did you do that? And so there has been a bit of a sort of cultural problem to overcome, in that what we've been saying is, if in doubt, give the vitamins. Don't argue, don't question, give them to people. Clinical staff, particularly midwives, have large caseloads and other priorities. We have a very poor, very poor birth outcomes in some areas of Birmingham, so that's all been under scrutiny in the last few years. So the vitamins are not always in the same place as antenatal, and the midwives can't carry those as well as all their other stuff. Department of Health supplies can be erratic. We've got a block on the women's tablets at the moment. They do tend to go in and out of stock. And the final one, I think, is probably our biggest problem, that the public don't feel vitamin D deficient. And it is surprising how hard it is to give away something free when people don't perceive the problem that we're trying to solve. Potential risks. We start the children's drops at 2 to 4 weeks, and that's against the Department of Health recommendation. That's because of the risk of exceeding the recommended upper limit for vitamin A, because if the baby is formula fed, they'll be having quite a lot of vitamin A from the formula by the time they're having a significant amount to drink. However, our cases of hypocalcemic fits have been in formula-fed babies. It was 50-50, the cases that we looked at, breastfed or formula-fed. So the formula obviously isn't sufficient to correct the vitamin D deficiency. The paediatricians on the group also assure me that they've been discharging babies on formula plus Abidec for many, many years, and they don't really perceive it as a risk. And obviously, just my last point there is a reminder that vitamin D deficiency is potentially life-threatening. There have been 3 deaths in recent years. So we feel that that risk is justified within Heart of Birmingham with our high-risk population for vitamin D deficiency. Measuring uptake. This is the difficult thing. We ask bases to tell us how many bottles they issue. We also have a central distribution point, so we know how many bottles each issuing base orders, and we also know how much we spend on vitamins. So by combination of these, we roughly think that we're now reaching 17% of women in our target group and 12% of children. Now, after 4 or 5 years' work, that's not amazing, and particularly if you put it in the context of this morning and the fact that we're probably not giving people the dose that they need. But I think it just shows how challenging any public health intervention of this sort can be, and the logistics of this are surprisingly complex. So just a bit more on to back up that we are getting them to more people. Our spend's gone up. The spend per month has increased by 250%. However, the price of the vitamins has gone up as well, and we haven't been able to match those because it tends to be collected yearly, the spend. So obviously it's not quite doubling, but we have got an improvement. We carried out a case-finding exercise during 2005 and found 29 cases of vitamin deficiency in children under 5 registered to GPs in the Hob PCT area. Now that was children who had low vitamin D and symptomatic vitamin D problems, so rickets or hypocalcemic fits. This was repeated for cases during the year to March 2010, and only 12 cases were found, although there were 21 cases in total with Birmingham postcodes. So based on that, one of our paediatricians has calculated that our incidence of vitamin D deficiency disease has decreased from 120 per 100,000 to 49 per 100,000 in 2010. Now, I would hesitate to claim we've achieved that by our campaign because we know we're reaching relatively low numbers. However, it's been very useful to us in that we've persuaded the powers in public health to roll out the campaign to the whole of Birmingham, which makes sense in the context of reorganisation. We are working as one public health service across Birmingham now instead of 3 PCTs. We've cut the eligibility for children to age 4, mainly for logistical reasons. Children aged 4 to 5 tend to be in school and aren't going to nursery as much, going to children's centres and health centres as much. They're harder to reach. But also it was a way of making the possible potential cost of this campaign cheaper. The rollout was only in February of this year, so we haven't been able to measure any impact yet, and we've no guarantee of funding in 12 months' time. What does it cost? Our budget's only 113,000 per annum, which would be hugely inadequate if everybody took up the scheme. We do have some costs other than the vitamins. We have to pay for deliveries, and we actually at the moment pay the pharmacist to give out the vitamins. We haven't managed to get them to do it for the good of the city yet. We're hoping to get there. So far it's affordable, and we can claim back from the Department of Health for people who are eligible under the Healthy Start scheme. The problem is that presents our issuers with an extra barrier. We don't want them to use that as a reason not to give the vitamins. We want them to ask whether people are eligible for the Healthy Start scheme, but at the same time as handing them the vitamins and just make a note. So what they tend to do is give out the vitamins, put no, not eligible. So we're probably massively underclaiming from the Department of Health. And we will need that to help with our finances. The cost of not treating, well, I'm told that treating each case will cost about between £2,500 and £5,000. Everyone will be aware that there are also hidden social costs. If a child doesn't learn to walk at the stage when it should, there'll be other developmental milestones that child doesn't reach. The cost, if we don't reclaim, for one woman from the start of pregnancy till her child is 12 months is under £10. And to give the children the drops until they're 4 would be £41.86. That should be a dot there, not a comma. There's always one thing that sneaks through your proofreading, isn't there? Obviously, not all unsupplemented children would develop rickets, but we know there's growing evidence of other risks of suboptimal vitamin D levels, and obviously we can reclaim some of our cost. So that's our experience. We've shared some of this with people around the country, and we're really interested to learn from others. I think the thing that struck me from earlier today is the other enormous problem that we're seeing in Birmingham is the increase in cases of gestational diabetes in our ethnic minority mothers. And it looks as if we need to be doing a lot more than this if we're going to have any impact on that. But that's for me to take back to our vitamin D working group. Thanks very much. Any questions?
Sorry, Rosie Dodds from NCT. I was wondering if you knew of any other areas where vitamin D supplementation is universally free, and particularly in relation to Scotland.
Yes, Blackburn have certainly had a universal scheme for some time. Cardiff, I think the whole of Wales are going for universal supplementation for women. Bristol's got a pilot with universal for women. I don't think there's any area as big as ours doing universal for mothers and children, but there's lots of trials of universal in other areas, and I know that other areas are feeling a bit like us. I mean, your point was well made, thank you very much. We have achieved more than other people, but still for the amount of time and effort, it seems slightly disappointing. And I think certainly there's people who want to look at the whole scheme to see if there's any way of making it simpler so that people do take the vitamins.
In terms of the Healthy Start, it's not meant to actually address a vitamin D deficient mother or child, is it? So are you thinking of also doing a parallel path with vitamin D as well, or not?
That's a very good point. This is assuming everybody has reasonable levels. Our GPs have quite a high level of awareness, and they do test quite a lot of women. But I do think that because there is relatively poor understanding in the population, people will get treated as vitamin D deficient, possibly in one pregnancy, and they won't then take a maintenance dose of vitamin D, so by the next pregnancy they could well be deficient again. But you're right, this dose isn't enough to correct deficiency, so children can still be born deficient even if their mother has taken these according to our guidance.
Because I'm from Newham, and we're very similar to you, and we're thinking about, and Lisa Hamlets is here as well, we've been talking about some universal models, but it's actually, if we presume that we do have a vitamin D deficient population, which we probably do, we have 60% non-white in Newham, it's not actually going to address the issue. So I just...
Yeah, I mean, it has been raised with our directors of public health, and the GPs are particularly concerned because, as somebody said earlier, the treatment for vitamin D deficiency is not made in the UK. It's imported as specials, and it can cost a fortune. Basically, an individual will take the prescription to their pharmacist. He will source something to meet that prescription. He can really charge them what he likes. That cost shows up for the PCTs. So I'm gathering that together and trying to get a meeting. One, to look at if there is a way of sourcing treatment for vitamin D, treatment levels of vitamin D in a more cost-effective way, perhaps working together with the hospitals and the PCTs. But I think also to keep it on the agenda of public health that this is a bigger problem. Their answer a year ago was, we'll get on with sorting out the women and children where we do know what we should be doing and what national policy is. But I agree, I think there is a bigger issue.
I was wondering if there's nice guidance on this for pregnancy, perhaps if vitamins are given out at the booking visit and at the antenatal visits, we could cover wider part of the population and prevent deficiency in the newborns in any case. And as far as addressing the children, because I know from having been a community postnatal midwife how few families actually attend, the healthy start and the sure start, and there must be a better way. Certainly getting to the women when they go to their antenatal care.
But that's how ours works. All the antenatals now are held in children's centres. So the midwives have declined to carry the vitamins with them, and I have a certain amount of sympathy with that. They go into a room that's not necessarily set up as a clinical room, and they have to bring a lot of equipment. But then the reception has them. But that means that the receptionist and the midwife should say to the women, get your vitamins on the way out. And I think that can be patchy. But yeah, that is partly how it works. And I think that's why we're slightly more successful with women than children.
At the moment, in the Northwest, I'm running the vitamin D awareness and promoting vitamin D to prenatal and postnatal women. And the audit is a regional audit. And we know that the uptake of vitamin D is very low. Are you doing anything to educate or train or have any training packages for the health visitors or the midwives? Because I think if we're not promoting it at the first booking or the primary visit, we're not going to get that message across. So have you got a training package, or are you targeting those, professionals that are at first contact with these women?
Yeah, we have done, and there's sort of a bit of a rolling programme to top that up. When we do surveys, health professional awareness is very, very high. I'd say the floor comes in when they've got 40 minutes to do a booking appointment, and that woman has huge social problems, and they deal with those, and vitamins fall off the agenda, as does obesity in Birmingham. We've got 20% of women are obese at booking appointments, who are getting nowhere near those referred to our services. And our services to treat obesity, to manage obesity in pregnancy, will probably be decommissioned this year because we're not getting those referrals. So I think that just gives a good parallel of how hard it is to get these things that are seen as peripheral onto the agenda.
Do you have a prompt to prompt your health professionals to?
It's in the antenatal notes that the patient has, yes, vitamin D.
Eleanor, thank you very much for your very informative talk. I just wondered, what thresholds are you using to define deficiency in Birmingham?
Where we did the case finding, it was 10 micromoles per litre. 10 micrograms per litre was our cut-off. And there were some cases picked up that were 10 or below, that were picked up incidentally and hadn't got symptoms of vitamin D deficiency, so those were left out. The cases we picked up are only children who actually had rickets or hypercalcemic fits and a vitamin D level below that.
So your cutoff is really 10 nanomoles per litre.
Yeah, for the case finding.
Thank you. And just a comment about the treatment issue. I realize there are difficulties in getting some treatment doses. However, there are some good examples of hospital pharmacies making up doses specifically on prescription and providing it to the patient. So maybe that's something that you could.
Yeah, well, I'll make contact with you. That would be useful because I mean we've got I think we've got the Children's Hospital where they do treat quite a lot of cases, but there are also a lot of people treated via the GPs who go to their corner pharmacy. So I think we probably need to draw up some guidelines so that they come through the hospital pharmacy in some way, because otherwise the cost is so high. And then, but I think if we do that, we would ask for the cost to be reinvested in vitamin D deficiency prevention.
Yeah, I'm quite sure that St George's Hospital in Tooting is already doing that.
That's great, thank you. I'll be in touch then. Yeah.
Thank you.